Hi everybody. Are you a lady and have you been recently diagnosed with gout? Then don't worry, the diagnosis is totally wrong. I will tell you why. Hi, I am Dr. Pradeep Kumar Shenoy, consultant rheumatologist, addressing from Amrita Center for Rheumatoid Diseases in Mangalore. In fact, I am the first DNB consultant rheumatologist of India. I will tell you why ladies don't develop gout. There is a hormone called estrogen in the ladies which actively excretes uric acid from the blood into the urine via kidneys. So their uric acid level in the blood always remains low compared to men. Even after menopause, when the estrogen level goes down, the serum uric acid level in a lady always remains low compared to a man of the same age. A lady rarely or never ever develops gout. This is one of the rules that is taught in rheumatology. Now, let us look into uric acid. What is uric acid? It is nothing but a metabolite of purine. Purines are dietary components of our food. So, if you look into purine metabolism, let us focus on to the last two stages or steps, that is conversion of hypoxanthine to xanthine and xanthine to uric acid. Both the steps are mediated or regulated by the enzyme xanthine oxidase. And if this enzyme has got activity which is higher than normal, then there will be overproduction of uric acid in the body. Otherwise, if the uric acid production in the body is normal, but if the body fails to excrete it in the urine, then again the serum uric acid levels will be high. So, this is the mechanism of hyperuricemia. In some patients, both the mechanisms coexist. To some extent, the serum accommodates uric acid, but beyond a certain point, when there is supersaturation of the serum uric acid level goes beyond the supersaturation, then serum urate crystals start depositing in the different parts of the body like joints, skin, soft tissues and kidneys. They are called as monosodium urate crystals. When they get deposited in different parts of the body, they produce corresponding symptoms. Let us look into different phases of hyperuricemia. First phase is asymptomatic hyperuricemia, then it is followed by acute gout, then there is a phase of intercritical period, then there is chronic tophaceous gout. Coming to asymptomatic hyperuricemia, this is a golden opportunity to look into patients' BP, sugar, cholesterol, and uric acid, because hyperuricemia most of the times is a part of metabolic syndrome. So, when a patient is detected with increased uric acid in their blood, I usually check their blood pressure and cholesterol in fasting, at the same time fasting blood sugar as well. And if I find their serum uric acid, sugar and cholesterol high, and if their BP is also high, I tell them to maintain ideal body mass index. This will help everything. Also, I will tell the patient to go on a diet, that is to cut down red meat, organ meat, seafood, milk and milk products, cauliflower and cabbage. So this will bring down the uric acid level as well. Coming to the next phase, that is acute gouty arthritis. As I suggested right now, the hyperuricemia is a part of metabolic syndrome. So if the patient is having hypertension, he goes to the doctor in the morning, doctor checks the BP and finds the BP to be on the higher side, and doctor prescribes a drug, that is hydrochlorothiazide, and if he consumes it, that particular night patient develops first episode of acute gouty arthritis. Patient wakes up from the sleep with severe pain and when he gets up and looks at the toe or the base of the toe, it will be red and swollen. When he touches that part, he will feel the warmth. Even the blanket that he has used to cover him, when that touches the base of the great toe, he will have unbearable pain. This is nothing but classical episode of gout. This is usually self-limiting. We use drugs like colchicine or NSAIDs or painkillers to treat this. Within 2 to 3 days, acute gouty arthritis goes away. Now, from the first episode of gouty arthritis to second episode of gouty arthritis, this period is called as intercritical period, and this can last for more than 1 or 2 decades. So we won't start serum urate lowering agents like febuxostat and allopurinol when the patient is having first episode of gout. We usually start it when the episodes of acute attacks of gout crosses 2 to 3 episodes per annum. We also tell the patient to go on a strict diet. We advise them again to avoid red meat, organ meat, seafoods, milk and milk products, and cauliflower. And after this, if the uric acid levels are not well controlled, they go into the last stage, that is nothing but chronic tophaceous gout. Here, the crystals of uric acid, that is monosodium urate crystals, deposit in the skin, soft tissues, and in the kidneys. In the skin, they can be seen as white cheesy materials. In the elbow, around the olecranon bursa, there can be hard swellings, the hard to firm swellings of white cheesy materials. This is nothing but tophi, and they can be also seen in the ear lobules. And when uric acid crystals, that is monosodium urate crystals, get deposited in the kidney, they produce intense inflammation and produce a interstitial nephritis. Again, monosodium urate stones can be formed in the ureters and they can obstruct the flow of urine. Both the conditions put together can impair the renal function, and the serum creatinine, that's a measure of renal function, can start going high. This is the most severe form of hyperuricemia, I would say. This should be prevented. And coming to the differential diagnosis of gout. Gout has got many differential diagnoses: palindromic onset rheumatoid arthritis, palindromic rheumatism, reactive arthritis, psoriatic arthritis, and undifferentiated spondyloarthropathy. These are the differential diagnoses of gout. So, if there is an arthritis which is sudden in onset affecting the base of the great toe, that is not synonymous with gout. One has to think about all these conditions. And when you look at the treatment, allopurinol is less potent than febuxostat. That is because febuxostat act on both oxidized and reduced form of xanthine oxidase, whereas allopurinol acts only on the reduced form of xanthine oxidase. And many people think that during the acute episode of gout, serum uric acid level will be high, but it is not so, because during the acute episode of gout, serum uric acid level goes down because uric acid from the blood goes into the joints. So these are the few tips regarding gout. How to live with gout, how to cope up with gout, and how to take the life forward, I will tell you in my next video. Please do follow me. Thank you.